Today we are talking about the mold illnesses, recovering from exposure, and what is it, toxic mold? Because I have to say that when I was in medical school, when I was in my medical training, and even shortly after when I entered the field of integrative and functional medicine, nobody really talked about toxic mold. This is relatively new diagnostic uh, entity, and we don't really know why, but there's some hypothesis why mold becoming such a big invader in our health and in our life of our patients. It used to be sporadically presented here and there, usually people with asthma and allergies, but now we see it to be so abundant. And we see there that toxic mold can play a role in variety of chronic medical illnesses, especially in elderly, including neurological disorder like dementia and other neurodegenerative diseases. We always have to rule out this secret invader of mycotoxin or mold in our immune system and how it affects our overall health. So it's with that, and we're going to start talking about that mold is really prevalent. And we actually know, and I don't know if you know, but now you do, that over 50% of residential and 80% of commercial buildings have mold issue due to the water damage. This is why you commonly hear about the mold illness as their wet building syndrome. So as you can see the background of this beautiful mold growing on the walls, usually commercial buildings and governmental buildings like schools and police departments and other commercial buildings will have lots of it, and people don't really take care of them as well as we take care of our homes. When we see the mold, when we see the water damage, it has to be resolved as soon as possible, because otherwise mold grows not always on the surface, but it also grows within the walls of the buildings. And there's much to say about why mold comes and where it's coming from. So today we're going to talk about what is mold or mycotoxic illness and why it is so important to recognize and rule out in their presentation of any chronic illness. What are the typical symptoms of mold illnesses? What are some testing that we do to assess mold contamination, not only in our body, but also in our environment? What are some approaches to address mold illness? And we end up with some announcements, what's going on in our practice and what's new. So I hope you see my screen and you see my slides progressing. If not, please let me know, because sometimes there's a glitch in the system. So mold 101. So mold is a type of fungus that grows in the form of the hyphae, which are arm-like filaments. On this picture here, you can see this filaments and little hyphae, and this is how mold divides and spreads. They have a really fuzzy and discolored appearance, particularly when growing on food. So we see the moldy food sometimes when we leave that yogurt for a long time, or when we leave the bread in the refrigerator and it doesn't dry, but it's in that wet environment, start growing this green, beautiful penicillium. And it does require moisture to spread and survive. So therefore, places that have continuous moisture exposure and poorly ventilated will grow these beautiful mold colonies, like in this picture behind my face. So certain individuals with genetic susceptibility and perhaps higher than normal exposure time can have significant health impact from the mold exposure. So it depends on our genetics, and it depends on how long we're staying in the moldy environment. Is it just 15 minutes, or is it hours or days? Very common situation happens with people when during the pandemic, when we all were confined in our coops, in our homes, in the environment where we probably used to spend less time. Now we are confined for 24 hours. And that's when people started getting really sick from mold exposure, because now they don't give a break to their system and they constantly in the moldy environment. So the symptoms of mold exposure can resemble allergy symptoms that include just watery eyes, itchy eyes, sneezing, asthma, rashes, hives, brain fog, fatigue. But honestly, if the exposure is really long, we can really see mold affecting our immune system because it's immunosuppressant, and it can cause variety of clinical outcomes. So mold here, this is very important because mold exposure is one thing, but the mold species can release toxins as a part of their life cycle, known as the mycotoxins. And those mycotoxins are tiny and they're very damaging to the human body. So it's really difficult to filter them out. Okay, though some air filters do filter mycotoxins, but they are getting into our system through their skin, through their air, through the nose, and make us pretty sick. So the common fungi sources of mycotoxin includes species such as Fusarium, Aspergillus, Penicillium, Alternaria, and Claviceps. And examples of common mycotoxin includes aflatoxins, ochratoxins, gliotoxins, fumonisins, trichotoxins, and zearalenone. So those are the mycotoxins that we test. And we talk about the testing and different types of testing, direct and indirect. And but those are the variety of different mycotoxins. So a lot of mycotoxins come to us through the food. And those are the common food that contaminated with mycotoxins. Things like alcoholic beverages, corn, peanuts, some grains like barley and wheat, cottonseed, especially when they start making oil from it, rye seeds, sorghum, but also moldy cheeses, hard cheeses, or soft cheeses, soybeans, sugar canes, and sugar beets. So those are the common 12 that you might want to either rotate in your diet or eliminate from your diet when you experience mold type of illness. So this mycotoxins, the tiny little particles, can get into our body through their inhalation, ingestion, even skin contact from airborne mold spores, or food contamination, or of course, when we're exposed to the water damaged buildings. And mycotoxins have the potential for both acute and chronic health effects because they can inhibit the protein synthesis in the body, suppress our immune system response, and increase sensitivity to bacterial endotoxins. And we sometimes call the mycotoxin or mold exposure illness as the biotoxin illness. That's what you might hear as an interchangeable term. So what are the relationship between mold and fungal growth? So mold releases mycotoxin, as you learned, and mycotoxins have various effects depending on the type, but most can suppress or weaken our immune system. When our immune system is suppressed, some chronic pathogens like viruses, bacteria, or even opportunistic infection like Candida start growing out of control. And they push the microbiome out of balance from the state of the symbiosis, where it is a part of our friendly flora. Good example is Candida. Candida is a part of our friendly flora, to dysbiosis, when it becomes invasive and it becomes dominating and it basically takes over. So we see it in the gut, but we also see it systemically. When people exposed to mold, they have immune dysregulation and weak immune system. As a result, they get more viral infections, they get sick more frequently than others, or even compared to their life before the exposure. And the effect on the gut can present also as a dysbiosis in the form of small intestine bacterial overgrowth or small intestine fungal overgrowth due to these mycotoxins. So many people will come to my practice with their symptoms of gastrointestinal problems, thinking that, oh, we're just going to do the gut treatment. And usually we do, but they're not going to get better until we resolve this chronic mycotoxin or biotoxin illness. And commonly, we see layers and layers of different microorganisms that will be affecting the immune system because of their mold exposure. So some people will treat the SIBO, then we'll treat the chronic viral infections, then we'll discover that they have borreliosis or Lyme disease and Lyme-related infections, candidiasis, and on and on and on. So it's layers, and it's like peeling the onion. You probably heard that expression. So other symptoms of mold illness, beside the allergies, is also fatigue. And it could be a variety of the fatigue. It could be just that tired, cannot wake up in the morning, or just getting tired more than usual. Headaches, migraines, light sensitivity, vertigo, feeling lightheadedness, having this orthostatic postural hypotension or POTS. Because mycotoxins are neurotoxins, people start having some cognitive issues, poor memory, difficulty concentrating. And that's why I routinely check mycotoxin in my patients with cognitive complaints, which I see younger people complaining of cognitive decline. And unfortunately, our conventional colleagues, neurologists, are not trained on the mycotoxin illnesses, so they're not ruling it out as one of their neurodegenerative factors or triggers. Patients can present with a variety of their mental health issues like anxiety, depression, mood swings, but also red eyes and blurry vision, chronic sinus infection, especially if the mycotoxin is affecting the sinuses. And as I said earlier, because immune system is suppressed, frequent upper respiratory infections are also very common. So as you can see, can present like myriads of different symptoms, not just allergies and asthma. Other symptoms that you would not even think that it could be a mold related, things like excessive thirst or increased urination, morning stiffness or joint pains, abdominal pain, diarrhea, bloating. Of course, we talked about dysbiosis, but interestingly, symptoms like frequent static shocks or zapping sensation from electricity statics. So people with mold illness actually have a more propensity to experience those static shocks. Like they need to get grounded more frequently. Unusual skin sensation, tingling, very interesting symptom of buzzing sensation in the body that comes and goes. Like there's an internal phone inside of them. That's what patients describe. It's like a phone is on vibration and I feel it in my stomach, or I feel it in my chest, or I feel it in my ear. This buzzing sensation and sometimes even numbness, nerve and bone pain, and skin rashes. So sometimes we need to dig deeper and rule out mold illnesses and mycotoxin illnesses on patients with a variety of the symptoms, especially if they going in circles and don't get the answers and correct diagnosis and treatments. So how do we assess mold illness? First of all, if I listen to the patient's story and I review the question, I review their intake, which is pretty intense in my practice. It's 59 questions that new patients have to fill out because I want to know everything about you. I want to know everything from the childhood all the way to the point when I see you. If I suspect that there is mold playing a role in the clinical presentation, I usually ask my patients to fill out some questionnaires. And I have a variety of questionnaires that can point me to the mold or mycotoxin illness. We sometimes ask patients to do the visual contrast sensitivity, which is the test that is completed on their computer. And it will show us if the people have a contrast issue, differentiation between black, white, and all the shades of the gray, they usually have neuroinflammation and they cannot distinguish between colors, not the colors, the shades of the black and white. So that's the visual contrast sensitivity test. It is not a definitive test, but it points us to possibility of mold illness being there. And then we finally can do some laboratory testing. We can do blood tests that will detect mycotoxins antibodies, or we can do urine tests that looks at the mycotoxins that will be eliminated or excreted in the urine. The problem with the urine test is that we sometimes cannot differentiate if the mycotoxins that are present in the urine come from the food or actually from the inhalation. Or another problem with the urine test that I discovered for my patient is that sometimes people are not excretors, so they're not excreting mycotoxins. With the blood test, we're looking at the antibodies to their either mold particles or mycotoxins. And I'll give you an examples of those tests and show you what we're looking at. Sometimes we need to do even more extensive tests like organic acid test, or even looking at the environmental exposure like heavy metal test. We should include that in our differential diagnosis because heavy metals can also cause fatigue and tingling and paresthesia and neuropathy and joint pains and the cognitive decline. So the proper diagnostic workup is extremely essential. And then if we find mycotoxins in people's body, the first thing we need to do is to evaluate the environment. We have a variety of the different testing, like do it yourself or professional testing that we recommend to our patients. And all of that we usually discuss in our cases. So the presentation of their patient here, 33-year-old gentleman who has a 20-year history of eczema, chronic athlete foot, which is usually an indication of fungus overgrowth, mild asthma, and moderate seasonal allergies. After detailed history, it was revealed that his childhood home had a history of recurrent water damage from the roof leaks and in his bedroom, actually. And the basement was right next to the well, so it was always flooded. Asthma and seasonal allergies began shortly after moving to that house when he was only like in his early teens. So the symptoms that what symptoms would be indicated possible mycotoxin related activation is definitely his allergies and history of exposure to wet building, right? So we did the initial workup and complete blood test, comprehensive metabolic panel, and total immunoglobulin E, so because we want to see if it's a pure allergy, as well as some stool tests to evaluate intestinal permeability and chronic pathogen reactivity panel to see if he has any chronic viruses, chronic infections, and etc. Then on the second visit, we looked, we discussed his bloods, and it revealed that his conventional blood tests are completely within normal limits. And that's actually a very common story when patients come and they said, well, I've been to my primary care, I went to the allergist, I went to the neurologist, all the tests are normal. Also, interestingly, his autoimmune markers, which is non-specific ANA test, was also negative. But when we did the stool test, we saw that he has a chronic leaky gut syndrome, which is, as you know, a setup for pathogenic bacteria from the lumen of the gut seeping through the intestinal wall into the bloodstream, causing endotoxemia, causing immune upregulation, antibodies creation, and the complexes formation, and that creates a lot of symptoms in patients. So all this interesting functional medicine testing finds that indicates significant mucosal and systemic immune activation due to the disturbed intestinal microenvironment. So we always and often start with the gut first. So then we saw that the chronic pathogen reactivity screen revealed elevated immunoglobulin G antibodies to a variety of their mold or fungi, Candida, Streptozymex, Aspergillus, and Stachybotrys, which is the black mold. And these elevated antibodies against fungal organisms include yeast and mold and may indicate prior exposure to mold and mycotoxins with subsequent fungal invasion and overgrowth, which is a problem. So the follow-up mycotoxin antibody test was performed to confirm if this was an active issue. And IgG antibodies to mold species is the screening tool indicating prior exposure, not acute exposure. Acute exposure will be immunoglobulin E to mycotoxin or immunoglobulin M to mold. So antibodies to mycotoxin or urine mycotoxin testing can be used to confirm active storage or mobilization of mycotoxins. If we have unlimited budgets in our patients, which is not often, we would do both tests. We'll look at the urine, how much they excrete and what they excrete, and we also would look at the mycotoxin antibodies in the blood. If those match, that's great. If only urine shows positive tests, most likely it's the food exposure and mold is not a problem. So IgG antibodies to several mycotoxins were shown to be elevated in this patient, indicating that he has a colonization or active issue, not so much active exposure, but more of their immune reaction to this mold. So as I mentioned, we do recommend variety of the different testing. The ERMI test, which is considered to be a gold standard environmental test, is a great test that can be done by patients, by patient themselves, but usually done by professionals, and the patient's current living environment can be tested, indicating if there is a significant or not significant exposure. And his test came back within normal limits. Good for him, because the number one step in the mold illness is to removing patient from that moldy environment. Because if patient continue to live in the moldy place or work in the moldy place, we're not going to win this battle. We can treat them, but if they get re-exposed, they continue to be sick. So this is one of the tests that we do in the practice. And this is actually two tests, two patients that are family members, husband and wife. This is the husband. As I said, IgG antibodies to mycotoxins will show a tremendous exposure and tremendous colonization of the body with mycotoxin illness. When we look at the immunoglobulin E, the exposure was not as acute. So we know that this is a chronic reaction to exposure that probably took place more than 4 weeks ago. And then his wife, who is much sicker than him, has this result. So she has high immunoglobulin G, indicating that she has some chronic exposure to mycotoxins in the body. And mycotoxins usually don't leave the body on their own unless we treat them. And some acute exposure in the form of cladosporium toxins, acutely exposure, but variety of other mycotoxins are not really significant. So two people living in the same household, different genetics, different constitution. She's sick, he has just a congestion, but the tests are really indicating significant exposure. So how do we treat mold? That we usually treat it with antibiotics if we see clear clear indication of mycotoxins. We treat it with antifungal medications, things like diflucan or itraconazole, depending on the patient's need. And we always include some nutrients. And we're going to discuss the nutrients. And the nutrients that we use are usually multifactorial. So we always want to address the gut. So we use immunoglobulins to bind the pathogenic bacteria and maybe even mold and mycotoxins in the gut and prevent them affecting intestinal lining. We also use a blend of nutrients like this Gut Integrity Plus that includes the glutamine, DGL, aloe vera, N-acetyl D-glucosamine, vitamin A, and zinc to help support mucosal repair and strengthen the tight junction that maintain gut lining integrity and promote healthy inflammatory response. We always utilize some sort of probiotics, usually either spore probiotics, or probiotics of broad spectrum with variety of different probiotics. It's very important to give people sufficient support with vitamin C, N-acetylcysteine, and vitamin D, as well as quercetin, to promote healthy antioxidant support and support epithelial barrier integrity, again, as well as natural killer cells activity, so their immune response by the B and T cells will run in the proper way, and keep that immune memory in the B cells. So these supplements definitely do the job for that. And then it's very important also for some cases to use antioxidants like glutathione to help people to detoxify and protect cells from oxidative stress. Always given on empty stomach. Glutathione can be in a liposomal form as well as in the capsule form, which is much easier to keep around. You don't need to refrigerate it, and it can be used on demand. And it works relatively quickly. Don't forget that we use some binders. It could be, depending on the mycotoxins, we use a variety of the different binders, either charcoal or zeolite or fulvic and humic acid. I usually like to utilize broad spectrum binders because people don't show up with one specific mycotoxin. They usually have a variety of the mycotoxins. Remember that binders should be taken on empty stomach, ideally 2-3 hours after your meal, or at least an hour before meal as well, so you don't absorb and adsorb their nutrients from your meal. Also, don't forget that we need to support the healthy liver function. Phase 1 and phase 2 detoxification with the detox pearls and some of the herbs like milk thistle will be a really great support for detoxification and healthy liver function. And ultimately, when we know that we got rid of the toxins, mycotoxins from the body, it is extremely important to complete this treatment with their proper membrane replacement therapy, which usually includes fatty acids and phosphatidylcholine. And phosphatidylcholine also supports the bile that will move the mycotoxins with the bile into the gastrointestinal tract and promote healthy cellular membrane and mitochondrial function. So we recommend phosphatidylcholine in a variety of the forms, in the liquid, in the powder, in the gel cups. So it's all individualized. Each patient needs different things. So for our patients that we discussed, mycotoxin antibody test was obviously performed on a regular basis, and we saw that the numbers and their antibodies are decreased within 6 months after the therapy. The intestinal permeability on the stool test also was tracked, and it improved. And at 12 months, a patient reported resolution of eczema, athlete foods, and seasonal allergies, while also reporting improvement in cognitive function. That is really important to understand, that this is not a quick fix. Sometimes it takes us time to arrive to the mycotoxin illness, but then it definitely takes time to resolve the damage that was done by mycotoxins. So this is really important to understand. It's not a quick fix. So if you are not familiar with our e-store, we are inviting you to visit our e-store and maybe take advantage of these bundles for total body detox. We all know that we're exposed to so much toxicity in our environment, not only mycotoxins, but also environmental toxins. And this is a great bundle that helps you to gently detox your liver, gut, and kidney, and reduce toxic burden on the body. So if you're interested, please visit our e-store for this bundle. And of course, as you know, inflammation or inflammaging is the driving force of chronic medical illness, chronic illnesses. So if you want to de-inflame or deflame, this is a great bundle that I prescribe commonly for my patients and utilize it for my therapies as well. And that includes N-acetylcysteine, ultra turmeric, which is unique turmeric because it's already in active form. And I actually recently learned that and decided to bring this product to my practice because majority of the turmeric on the market are not in active form. Therefore, they need to be converted by the liver into the active form. The ultra turmeric in this preparation is already activated turmeric, so the body doesn't need to do that step of activation, and instead it can take care of the toxin detoxification and not to waste the enzymes on the turmeric activation. So, and of course, Power C, everybody needs vitamin C in their first aid kit because it's not just your major antioxidant that protects the tissues from damage, but it also a great immune supportive product. So it's a cold season. Remember, we all need to have several products, and vitamin C is in the list of their cold and flu protocol. We do have some free giveaway with the purchase of $150 on our store, and it's a no bloat prebiotic that is great for people who have a tendency to get bloated with prebiotics, but still need them to support healthy microbiome. And for those of you who are new to our practice, remember, we created this whole gut wellness program that can be done on your own. You can just get it, watch it, and understand the importance of the gut health in the development of chronic illnesses, or you can purchase a smaller version of our services with the 4 group sessions with the health coaches and informational program in the form of, and it's a monthly program, and it's $450. If you're interested, you're gonna get $50 off for just being here today. Scan this QR code or contact us for more information. Excellent, affordable way to get your feet wet in the functional medicine approach and treatment. So this is their, if you want to sign up for the sneak peek preview, you can do it on our Instagram, or just join the broadcast channel and you'll see a variety of different videos from this program. Remember, it's a cold and flu season. IV therapy is great way to either abrupt development of viral infections or recover faster. And for those who are new to our practice, we offer great discounts. For those of you who already been in my practice for a while and know about this genetic test that we utilize in practice in order to customize your treatment plan, we also offer free group support on a monthly basis. So you're not just getting the test, but you also get monthly discussion about your results if you're interested and want to attend. Remember that we are now also in Florida. So if you have friends or family in Florida and you want to spread the word about functional medicine, I do see patients there at least every other month. We are on Sunny Isles. So if you're there, please stop by, say hello. And of course, if you are already a patient, please send your friends to us. I know many of my patients refer a lot of word of mouth friends, and because friends don't want friends to go to the bad doctors. And if you want to refer someone, you can scan this QR code or simply call us and schedule the discovery call. So if you are new to our practice and you are interested to become a patient, it's very easy. You can call us or you can click on this QR code and schedule a discovery call with my team. Usually you will speak with either my administrative assistant or maybe with a health coach or maybe with Marty, who answers the call, and we'll be happy to explain how to become a patient. But if you would like to just stay in touch and sign up to our newsletter or Instagram account, where we usually post a lot of interesting tips and news. So I really appreciate that you took time to listen to my presentation today. And as a thank you for joining our live Q&A, we are offering you a discount code, which is QA-OCT for October 10. And you can get 10% off for the entire shop.